I'm Maddie at Church Lane Dental Practice. We're going to just give you a demonstration on how to brush your teeth. So we want to be brushing our teeth just before we go to sleep and at one other time of the day. You can use a manual or electric toothbrush. Electric does a better job with less effort. So imagine this is an electric toothbrush. We're holding it at 45 degrees to the gum, making sure that part of the toothbrush is on the gum, part of the toothbrush is on the tooth. And an electric brush does everything for you. If you use something like an Oral-B, which has got a circular head, it twists and pulses on its own, and you just hold it on each tooth, moving it along, making sure that the timer of the toothbrush coincides with you doing sort of each quarter of your mouth. With a manual toothbrush, you have to do a little bit more work, so still at the same angle. And what you want to do is small circular motions. This is going to get the gum and the tooth, removing all the plaque away from the gum line and the tooth, which is where you're more likely to get things that cause gum disease and tooth decay. What we don't want to be doing is scrubbing back and forth, because this can cause a lot of tooth wear. We also want to be using something between the teeth. So toothbrushing is great keeping all these teeth surfaces clean, but it doesn't work by cleaning in between your teeth, which is where a lot of the problems can lie. So you can use something like a floss or a TP brush. With floss, you just pop it in between the teeth. You want to just work quite gently, because you don't want it to ping and cause any trauma to the gum. You push it to the tooth behind and pull halfway down, and then push it into the tooth in front and pull halfway down and pull out. You do each gap between your teeth, working your way throughout the whole mouth. And you want to be using floss or interdental brushes before you brush twice a day.